Welcome to this conversation between Dr. Antoine Boivin from Montreal, Quebec, and Amanda Buck from who is joining us from Belgium, I think. Yes. My name is Mathieu Jackson. I work at the Center of Excellence on Partnerships with Patients and the Public, and I'm going to be facilitating this conversation this morning from Montreal. So very quickly, Dr. Antoine Boivin is right now involved on the front lines of the COVID-19 crisis. And Amanda Buck is a patient who has been diagnosed and is presently living with this virus. So we were very interested in having a bit of a conversation between these two perspectives, also from an international standpoint in two different countries. So we'll jump right into it because we don't have that much time where everyone here is very busy. So Amanda, could you please present yourself?
Sure. Hello, Mathieu. Antoine. Hello, everyone. My name is Amanda. I live in Brussels, Belgium. I have a family, a husband, 2 children, and I work for a patient organization. I have had symptoms for 15 days now and been informally diagnosed but not tested.
Amanda, can you tell us how this all started for you, and when did you start feeling sick?
Yeah, I started feeling sick 15 days ago. I'm unsure where I got it. I had some travel in Europe through 3 different countries 2 weeks before my symptoms developed. But I also had a big children's party with many different people who had themselves traveled in Europe for ski break a week before the party. And at least 2 people, one of whom is Italian, who were sick at the time with what they thought was the flu and pretty bad symptoms. So I'm unsure where it came from exactly, but I trace it back to that party and or to the travel a week before, because it falls in line with the 7 to 14 day period where people are contagious and you don't have symptoms.
Mm-hmm. So for you, it's about 7 days before you started your symptoms. You had contacts with people who were symptomatic and coming from countries and places where the virus was circulating. Is that correct?
Yes.
Okay. So how did it start for you? What sort of symptoms did you experience initially?
The first symptoms, dual symptoms that were a flag for me were extreme fatigue and extreme cold. And as you can see, 15 days later, I'm still freezing. It's a warm day. My children are outside in shorts and t-shirt, and I have 2 duvets and 3 layers, which is 3 layers less than I had in week 1. I really struggled to get warm, sleeping with a hat and socks, multiple layers, multiple duvets, and I struggled to get warm. My body wouldn't warm up. The fatigue was extreme as well. I slept during the day, I slept during the evening, and I had concentration problems. A few days after that, I started developing pain in my lungs. First in the top of my lungs, then in the bottom of my lungs, and a week later on my chest. But I never developed a fever.
You never developed a fever. And neither did you have cough.
I did not have a cough. I have a cough that's starting now, which feels like a cough just from irritation. But my throat doesn't really hurt. My ears hurt. But those symptoms came and went. First one ear hurt, then another hurt, and it went away. What always stayed was extreme fatigue, inability to concentrate, and feeling cold.
Yeah, and the cough you have now is more of a dry cough.
Yep.
Okay.
Yep.
So could you sort of describe how the diagnostic happened when your experience in the healthcare system, etc. How did that happen? How did that go?
So, being generally well informed, because I work for a patient organization, we followed this closely. I knew to stay home and isolate and drink fluids and wait, because I knew, comparatively speaking, that my symptoms were mild and I didn't want to be a burden. So I waited a week before I called my doctor. And by then I had to tell her, you know, I've had these symptoms for a week. And so, you know, what do we think? My doctor was already unable to see me. None of the GPs in the country were able to see patients face to face. She also told me that she's unable to do a blood test, which she ideally would have wanted to do, or to look at my lungs, which she also couldn't do because all of the machines were reserved for severe COVID patients. So we agreed that I would just continue to self-isolate, rest, and hydrate, and call her back in 3 days. And so we did that 2 more times. In the second week, I called her back 2 more times. And in the second week, my symptoms were getting worse, in regard that the fatigue wasn't going away and the chest pain was increasing. So I thought, having done the research, that I might be in the stages of no longer mild but moderate and beginning to develop pneumonia.
Okay.
Over the phone, we talked about my options, and I even asked her if perhaps I should have a couple of prescriptions just in case she got busy. I could already go to the pharmacy and get them if needed. But her point was that there's nothing to prescribe. She didn't think it was bacterial because I didn't have a fever. And I could take bacterial antibiotics against potential bacterial pneumonia, but it was unlikely that's what I had. More likely, I had something viral and there were no treatments other than what I was already doing, plus pain relief. I said I didn't want pain relief because I wanted to be able to monitor the symptoms and not ignore them. And then I called her yesterday morning saying that, you know, I'm getting worse. I'm also feeling dizzy. You know, are we still thinking the same thing? She said she would do some research, call me back. So she did. She called me back a few hours later and said she'd called a lot of centers. Nobody can see me. Nobody can do a blood test. Nobody can look at my lung. My only option is to go to emergency. And I didn't want to go to emergency because I didn't want to burden the healthcare system. I don't know what I have. I didn't want to expose myself to additional things. I didn't want to expose others to myself, depending on what I have. So I said I wouldn't do that. And then 6 hours later, I got very faint, quite dizzy, and I started questioning whether, just because I feel like I can breathe, does that mean that my lung is doing its work and I'm actually getting enough oxygen? Why am I suddenly dizzy if I'm resting all the time, hydrating, eating well? So I asked my husband to drive me to the hospital, and I went to the COVID testing center. And that's the first time that I saw someone.
Wow, interesting. There's lots of interesting points there. So you were actually diagnosed by distance in a way, or your first realization or that you had COVID-19 was not done in the clinical setting but from home.
Yes.
That's interesting. I think we'll come back to that. Also it's interesting the feeling of lungs not working, sort of that I'm sure that's something that other patients that are going through COVID-19 would relate to. That something which I can't describe and I can't imagine, but one of those things that you only know if you live with it, right? So I think that before we get into more of the conversation, I would like also Antoine to present himself and sort of present his experience also of the virus so far as a healthcare professional. So could you present yourself?
Yeah, I'm a family physician in Montreal. So I treat patients in primary care in the clinic. I'm also a researcher. So we've been very lucky in Canada in the sense that COVID first hit China, then Europe. And so we've had time to prepare much more than in European countries. And in the past 2 weeks or so, I'd say we've been very mobilized in our among our health professional teams to set up services in a way that learning from the experience in Europe. And personally, as a physician researcher, I've been, informing myself quite a bit and trying to understand the disease and what we should be doing, and also training some of my colleagues. But the fact of the matter is, currently we're preparing for the storm, but none of us have real experience caring for COVID patients. And so when I contacted Amanda, who's a good friend of mine, I was worried about how my European friends are doing. And Fred, her husband, wrote to me saying, well, Amanda has been a bit sick, and and I was actually quite worried and not sleeping well. And so we got in touch, and I thought there was a lot of things that we could learn from Amanda's experience. How I interpret this story as a physician, for me, this illustrates a lot of what we're trying to learn at a fast pace about COVID. First, the symptoms are very typical. The symptoms that are most frequent for COVID, the first one is fever. Amanda has not had that fever, but she'd had that feeling of feeling always very cold, the dry cough that has started recently, but most importantly, the fatigue that has been the most important symptoms initially. And more recently, questions about is this shortness of breath or dizziness or thing like this, and chills that you've been describing. The diagnosis of COVID is largely clinical, and one of the things that is challenging for us as clinicians, but also for patients and citizens trying to find out if they have the disease or not, is that the criteria to find out if somebody has COVID, it evolves with the epidemic, because there are two key things here. The first is the symptoms. Do you have fever? Do you have cough? Or do you have shortness of breath? Plus, have you been at risk of being exposed to the disease? And so, Amanda, if you had presented to my clinic in November 2019 with the same symptoms, I would have probably told you you have flu and stay home and don't worry about it. But now in March 2020, having had contacts with people from Italy, where we know the disease is strong, close contacts with somebody who was sick, then it increases considerably the risk that with the same symptoms, this is in fact COVID. The second aspect that is hard to grasp is access to diagnostic tests. And many countries now are struggling to increase their capacity to do tests. And because that capacity is not, cannot respond to all the needs of people with cough, fever, because there's thousands of them, then public health authorities and physicians and health professionals tend to prioritize tests for those people that are at risk of transmitting it to vulnerable patients. So currently in Quebec, for example, where we are very proactive in testing is in elderly care residents, because if you have if you were the same person, let's say Amanda, living in a building of 250 people with a large number of elderly patients at risk of dying from COVID, then probably they would have been very proactive in testing you in order to isolate other people around you that could die from it. While because you live at home, you're isolated with young children and a healthy husband, then your chances of transmitting it to people who could have complications is very low. They couldn't catch it, but they probably are not going to get very sick about it. So this is sort of why we make those kinds of decisions now about who should be tested or not, given the fact that we don't have the test for everybody. The third thing I hear from Amanda's story that's an important key point is that for the majority of people, catching COVID is a very small, is mild. It creates a mild disease. So that we know that for 80% of people with COVID, this is a minor illness with fever, with cough, and it goes away in a couple of days. But there are those 20% of cases that will lead to complication, which is the key thing that I've heard in your testimony is, how can you monitor as a patient when things are getting worse, and not hesitating to ask for a consultation and be evaluated if things are getting worse. So what you've described and what I hear is that you had a phase where you had no symptoms for about 7 days, which is the stage that is most dangerous for transmitting the infection, because you think that you're healthy, but you can spread it to other people. And this is why we tell people that have been exposed or that are coming back from travel or do have people around them that are sick, to stay at home for 14 days to make sure that they don't develop symptoms and transmit it before they get the symptoms. The second phase is when you start getting sick with the fever, the cough, the fatigue, and that usually lasts 2 to 7 days. And that was pretty much what you've told us, that you were feeling sick for about 7 days. And then for the majority of people, that will be the end of it. 80% will just start getting better. And what I heard in your story is that it didn't go better. And you started getting those respiratory symptoms, the pain when you breathe, feeling dizzy, and at that time you took the right decision, which is to go consult and be evaluated in those clinics that are set up in a way that can evaluate people with COVID. So the majority of people with COVID, we want to treat them at home with telephone follow-up, ensuring that they have people around them who can check on them on a regular basis, make sure that they are healthy, that they're improving, that they have groceries, that they're taking paracetamol or acetaminophen if they have fever, and et cetera, et cetera. And that's the basic care. But you also want to make sure that those people, if they get sicker, they can call a health professional and get evaluated, make sure that their oxygen level is good and that it's still safe to be treated at home, as is the case for you, Amanda, or whether or not they should be treated in the hospital. So I think there's a lot of really important learning points from your experience from a medical perspective.
It's a very complete answer. Wow. I was kind of hoping also to get sort of your experience as an individual, though, of how it was for you going through the crisis as a healthcare giver.
For me?
Yeah, for you, how do you personally live it? Being in the clinic. I mean, I thought, I'm not a healthcare professional. I'm a patient, and I think of healthcare professionals a lot. We talk about them a lot on the news. How is it to live that, to go through that with your family and with, you know?
It's hard. We're mobilized at all levels of what we are as human beings, as professional, yes, but also as parents and as individuals trying to, I mean, for me, the main challenge is to keep balance between professional and personal life, to try to stop thinking about all of this in the evening and get a good night's sleep. Not trying to save the world by my own, so take time to rest. And also, I mean, our experience in Quebec and Canada, and again, I think it's very different from Europe, is that for the past 2 weeks, we're March 26 now, we know that there's a wave coming, and that many people will get sick in the next couple of days and week, but it's not the case currently. We do have cases, and we're starting to treat COVID patients, and some of them are in the hospital and in the ICU, but it's still in reasonable numbers. But there's a lot of apprehensions and anxiety and fear. We hear about our colleagues in France and Italy. I was talking yesterday to one of my good friends who's a physician, and his wife is a nurse in Spain, and the situation is very and so it's worrisome to what is going to happen. There's a lot of uncertainty, and it creates anxiety for health professionals and for me as any human beings. But my worry, I would say, my main worry are for, I would say, my own parents, my friends who are older, who could have really severe complication or die from the disease. It's not about the risk for my own health or even the health of my children, because we know children are very well protected by that disease. It's very rare that they get complications.
That's very interesting, and and Amanda, feel free to kick in as well if you want, if you have something to say from what Antoine says. But you mentioned, Antoine, I was at the hospital yesterday morning actually for my hemophilia care, and the first thing that struck me, it did feel like a little bit, when we say in French, le calme avant la tempête. Exactly. So it really did feel, the first thing that struck me actually was that this Hôpital Maisonneuve-Rosemont, which is this gigantic hospital, usually bustling with people, it's like a city, right. And it was empty. Yeah. There were guards at the front door. You know, what are you doing here? Why are you here? But it was kind of funny. So you could see that everything was ready for a crowd of sick people, but no one was there. Yeah. And I was curious, Amanda, how are the hospitals in Belgium? What did it look like in this in a country where it's more advanced?
Yeah, I don't know. I haven't left my bedroom in 15 days. When I went to the Red Cross tent yesterday, I wasn't in the hospital because the COVID testing center of the hospital I went to is a series of Red Cross tents and trailers that are in the parking lot across from emergency. So all I've seen is what you've all seen in the news, and I have friends that are healthcare providers, and in Italy and Milan notably, and it sounds and it looks far worse than what I witnessed. When I went to get tested or evaluated, because I didn't get tested, it was very calm. It was calmer than I expected. A week prior, I had communicated by WhatsApp with that friend, the Italian friend who was sick, and she said that there was a lineup at the testing tent. When I went, there was one person in front of me, one person behind me. Otherwise, it was empty. The staff were very friendly, very relaxed. They were joking, but the whole thing was incredibly well set up. Different trailers. Everybody was dressed in full gowns, full medical gowns, had the mask, had the goggles, or it was more like a shield. Every tent or trailer you entered, when you entered, you disinfected your hands. Every room was disinfected after you've left it. So it was very well organized. Similarly, waiting for the storm. I know that the country in general hasn't yet seen all the patients that they expect to see, but I don't know what the inside of an emergency room looks like because I didn't see it.
Yeah. The echo we have is, well, if I can just share another personal experience as a physician.
Go ahead.
Which is, for me, it's a bit of the silver lining of the experience. I quite remember a week before this started awareness, before the confinement measures were implemented in Quebec, and this, our lives of everybody changed around March 12th. We had a team meeting the day before And we were struggling, feeling that, we can't cope with that, all the work we have. And this was quite difficult. And people felt exhausted as team. But the following week, I walked into that same clinic with the same team to do my clinical shift. And I cycled back home thinking, I have just witnessed the most profound, rapid, and intelligent revolution in healthcare of my whole medical career.
Mm.
Suddenly, we're doing over 95% of our consultations over the phone, and we deal with those cases in a very safe way. We think about the actual value of what we prescribe in terms of tests and so on and so forth, which reduces unnecessary demand. We realize that patients can be trusted as partners. We are forced to trust them because we're on the phone with them, and they suddenly become our eyes and ears and hands. So I've evaluated a child with her mom, and she was re-empowered to be the primary caregiver for this child. And I was simply a counselor to her. And we've realized as a team that we've started really working as a team because we were forced to do. And so we have this team of clinicians on. First, the receptionists are now part of the team. They do the first evaluation and they refer patients to the appropriate information lines and self-management tools and etc. So they are suddenly been incorporated in the team. Second, there's a team of clinical individual evaluation with a physician, a nurse practitioner. There's soon going to be a psychosocial professional and a medical resident. And we work in team to evaluate the clinical cases over the phone. And we help each other. When I don't know what to do, because we're all facing the unknown, how to manage new chest pain from home. Is it more dangerous to be investigated in the hospital or to be treated at home? It's very complicated and you can't think alone. So we tend to work, to consult each other. And so this has really transformed the way we do things, but in a very positive way.
That's very interesting. Actually, Amanda, I was wondering how do you feel about that? Sort of, you said that you yourself decided not to go to the clinic, to call. How could you develop on how you felt during that process as a patient, and did you give it any thought?
Yeah, there are quite a lot of angles to that. Being aware of the environment, the news, etc. I think your first thing is, I'm not dying right now, and I don't want to be a burden. So, and we know we shouldn't just show up. So I made the phone call. In my GP, she's new. I just lost my GP to cancer, and so my new GP is new and she's quite young. So to be honest, I was really grateful to have time with her on the phone, but I was also really grateful that she admitted when she didn't know something. She said she would consult colleagues and call me back, and she always did call me back. It was very collaborative. I think I echo what Antoine said, we really relied on each other, and I felt that knowing that she had no other patients, knowing that she's only taking phone calls, I had a little bit less pressure on me. Usually I try to be quick. I try not to waste their time. I often forget a symptom when I see them face to face. But here I had the time to explore options, really discuss risk benefit and say, okay, so if it's bacterial, let's talk that through. If it's viral, let's talk that through. What are the risks and benefits of showing up somewhere where I could contract something else, or I could infect someone else? And there was an element of co-decision making. I felt like I had the final decision always, but I felt well advised on what my options are, and that I had an open communication line, and I appreciated that. I think that there are a lot of efforts in the healthcare system right now to do things differently. I see some of them working better than others. The phone call was good. I'm grateful. Before I went to the clinic, to be honest, my best conversation was with Antoine when he called me, because it was by video. He could see me, he could share graphs with me. We had a more in-depth conversation. He was also the first person that showed me that my symptoms could be COVID. Because, for example, I'll compare this to another healthcare system effort. One of the major universities here put out a questionnaire to the public to help you self-diagnose at home. And so I did this as well. But the main question of the questionnaire is, do you have a fever and a cough? So I click no, and I instantly get a response saying, you're fine, you don't have COVID, move on, go on with your life. And what's nice is that there's a questionnaire. And what's nice is that they send you this questionnaire every day or every 2 days to monitor your progression. But what's frustrating is that that's the only question. And and my answer is no, and that's it, it's done. And it's only from Antoine that I found out that there are other symptoms. And it's when I showed up to the clinic yesterday, to the Red Cross tent, that they said, your symptoms are in line with COVID. Because before that, I just felt crazy. I was like, am I hypochondriac? Is this a bad flu? I've never been in bed for 14 days back to back. And yet this questionnaire is telling me that it's impossible that I have COVID. So I'm aware we're trying to save lives, and I'm not severe, and that we don't have enough tests, and the tests are saved for the severe, so that's all fine and good. But we are not learning, and nobody's having a conversation about what mild and moderate looks like. We're not testing, which means we don't have the statistics, which means that we don't really know. And if I do have COVID, well, then that university questionnaire shouldn't just say, because I don't have a fever and I don't have a cough, I don't have COVID. It's a loss of learning, and it's a loss of my own patient experience with it. I don't mean to rant on, but I would like to know what I have. And my Italian friend is very upset because she wants to know what she has, because it changes our behavior. It changes our choices now and in the future. If I know I have COVID, I will take certain steps. If I know I had COVID, I will take certain steps. But if I don't, if this is just the flu, I go out into the world more weakened and more susceptible to COVID.
Yeah. That's one of the things that struck me in the conversation we had earlier with you, Amanda, that I learned from your experience, is that before I was thinking of COVID tests as a tool for physicians and public health experts to inform their own decisions about whether or not we should, for example, implement public health intervention measures for certain population and adjust the intervention for elderly residents, etc. And I was informing also my my clinician colleagues that from a purely medical standpoint, being diagnosed with COVID or without COVID, it doesn't change the actual medical management, because there's no specific treatment for COVID. So you treat the fever with acetaminophen or paracetamol, and if you develop respiratory failure, then you need oxygen. But whether or not you have respiratory failure for a bacteria or COVID or any other reason, it's the same treatment. But what I learned from your experience is, for you as a patient, knowing that you've had COVID will inform first decisions about protecting others, implementing stronger measures to protect others, but also in the future, knowing that you're probably protected from reinfection, which is what we know at this time, then it could change decisions about your work. Or I'm even thinking, for me as a healthcare provider, if I know that I've had COVID and I've recovered from it, then it would, I could very much say, well, okay, then I'm going to work in the COVID clinic from now on,
Yeah.
or in the ICU, because I'm at no risk of recontracting it and retransmitting it to others. And so these are important individual decisions that will be informed by that test.
Or the inverse, because if you've had a flu that's been really bad, and then you go to work in the COVID thinking that you're now immune, but in fact your system's weak and tired and drained from having, then you're even more vulnerable.
Yeah.
We're in an emergency situation, so it's understandable, it's fine. But I think we will want some kind of antibody test in some future that tells us whether we had or didn't have it.
Yeah.
And I think we need to have that for our scientific and our statistical understanding anyway.
Yeah.
Please go for it. You were going to say something?
No, I'm just saying.
It's very interesting.
Could go on for all day.
Yeah. You mentioned, I found it very interesting, Amanda, how you mentioned how you described sort of you kind of, in your story there were sort of two scenarios for telemedicine, an automatic machine that doesn't think. And then it's only when you actually were able to speak to Antoine and, that see each other on and have a conversation that you really could go forwards and then make your own decisions. So I think that was a very interesting sort of little capsule of what could go wrong and what could go right in telemedicine for the future.
Yeah, I think that, the video conferencing is probably better than a phone, but a phone is a good first. A phone is good for your immediate decision making.
Yeah.
I think the video call helped me have a broader context, and it deepened and broadened my understanding, which was better. But a telephone call is certainly the first stop.
Yeah, I agree with you. And the other point to this that resonates for me as a primary care physician is the importance of knowing the person at the first place. When you mention, it's the first time in my life that I've been stuck in bed for 14 days straight. It's an important information, and the advantage I would say I had over your new family physician who hasn't known you for a long time is that I've known you for over 10 years. And so that's an edge. That's a diagnostic edge.
Yeah,
and
true.
I think then it's not so much about the video conferencing than knowing the person you're interacting with, and having established a relationship of trust as well. That really has been key. And in Quebec, there's been a very strong push actually to strengthen general phone response team for general questions and information. And that there's definitely a room for this. But my experience is that for us as a primary care team, who know as a team a population of 12,000 patients who are registered to our clinic, doing our piece and calling those people that we know and who trust us really makes a difference. And it allows us to go much further with them and pick up when something is wrong, or find out also which people are most at risk of not showing up when they are sick because they don't want to bother, or people who we know are more anxious and will call and basically not because they need to be admitted to the ICU, but because they need reassurance and psychosocial support, and maybe they're suffering from social isolation. So it helps us, because we know people, to find out what the true problem is and working as a team to address it.
Yeah, I'll just correct you on one point, Antoine. It's been 20 years.
Oh, it's been 20 years. So
But who's counting? We still feel young. I remember from when I lived.
we still feel young.
I remember from when I lived in Quebec. I forget what it was called. Is it Info Santé?
Yeah, that's it.
Which I loved. I used it all the time because I had two little children, and as you know, in Quebec, it takes forever to get a doctor's appointment because there's a scarcity of doctors. So I use Info Santé a lot, and to be honest, I haven't come across that service in other countries, and that's Quebec is well established or well organized in that sense. I also saw the pamphlet that you sent me from the Quebec government on COVID,
the self-management tool. Yeah.
Very useful because it gives you sort of like a decision-making chain that you can follow. It's very patient-friendly, which I also haven't seen in Europe.
Okay, so for you, that was it would have been empowering if you had access to a tool like this, but also to that Info Santé line.
Yeah, because you know what you know from the general public and the news, and then you have your own symptoms. There's a lot of guilt. There's a lot of responsibility that you feel for the public health system, for healthcare workers, the solidarity, I'm not bad enough, but how bad do I want to wait until I'm that bad? Like, at which point, if I went because I was busy and I was like, okay, if I faint now, it's probably worse. It's probably worse for my husband. I don't want my children to see that. But I know I'm not dying right now, so I don't want to be a burden. It's really difficult to make that call. And even though I look fine, when I asked my husband to drive me, my daughter started crying because I hadn't realized to which extent the fact that I'm in bed for 2 weeks is affecting them. I'm not hugging them. I'm keeping them at a distance. My children don't know what's going on. I had informed the neighbors. I hear my children playing outside, so I think they're fine. But just realized 2 days ago, because I asked them, that actually they feel really lonely and they feel stigmatized, and they go outside and everybody's avoiding them. So, other than the clinical decision making, just as how you manage this, it would be helpful to have some kind of. And I understand it's not there because we're all learning, but maybe this is the learning as well, that when you're a patient, you also deal with your family, your husband, your children, your work colleagues, because you're still sort of working, because you can't be in bed for 2 weeks without going crazy, so you're happy to work. But you can't work a lot because you can't concentrate, and you have to deal with the teachers that expect you to homeschool your children full time as well. And there's an entire other side of this that needs to be managed. Sorry,
Amanda,
I'm ranting.
I'm curious. The first time we spoke over a video conference, I remember after we had our talk with yourself and Fred, just the adults, during the consultation, then your children walked in and you turned the camera, and I felt like I had the responsibility of announcing to them that I thought that their mother had COVID, and I thought it was my responsibility to tell them, but also to reassure them that she was going to be fine, and this was minor, and it was okay to stay at home. And but I'm curious, has it generated anxiety? Have they worried about you more after I said this?
It's funny because that happened very organically. We didn't discuss it.
No, I know.
In hindsight, I didn't mean to put you on the spot. It was more that they came and you know them well, and so I was just sharing. But indeed, it happened that way. The answer to your question is no, at least not with me. I don't know. Fred spends most of his time with them now. I don't know if they've discussed it. I don't think they have. He hasn't said anything to me. I discussed with them early on. They knew early on, even before the schools closed. We warned them that the schools might close. We had conversations about what it is, what the risks are, and then we told them that I might have it and I might not. but we're just being careful. And to be careful to protect other people's health, we're just going to keep this distance. And they seemed fine. And we had the conversation a few times just about, remember to wash your hands, it's no big deal, but just in case, all of this is just in case, wash your hands, you know, we can't hug. And they seemed fine until I found out that they're not fine, because I asked them, and how are you feeling? You know, when you go outside for a break, how do you feel? And then they told me, because you wouldn't tell by looking at them. And they're very happy to help, you know, they're very happy to bring tea. Mama, do you need anything? They make me lunch. And as a parent, you're like, oh, they're being so wonderful. This is such a growth opportunity for them. You know, they're learning responsibility and they're learning to help out in the household, and you know, and they're still smiling, they're still happy. But if you don't ask them, you don't know what they're feeling. And Anaya cries because she misses hugging me. I mean, the lack of physical contact has taken a toll on her. I hear her crying every night. And she cried when I went to the clinic because she didn't know what it meant. So yeah, the conversation should be had. I like that you told them. I like that they heard it from another perspective, not mine, from you. They know you well, they trust you, and you're a doctor.
Yeah.
Also made me feel less guilty. I think when you're a mother, you always feel guilty. You're always like, my symptoms bad enough. Shouldn't I go make their lunch? You know, you gave me permission to be sick, which it's not, you know, you know, there are a lot of people that are like me, especially, you know, women who are mothers, that you don't give yourself the permission to be sick, and you always question. Like even now, I'm like, am I well enough? Should I go and, you know, at what point do I get to just say I'm sick, I can't do this, or I shouldn't do it?
Yeah. I saw your automatic email reply saying,
managing
sort
expectations.
of guilty to say, well, there may be some delay in my response to professional emails this day. Like,
I noticed that actually. It was not, yeah.
Because I usually get 250 emails a day. That's the way I have the energy. But to be honest, I've been getting like 15. It's fine. I can handle it. But yeah, I felt like I had to manage expectations and remind people. I am, you know, I have symptoms. It sucks, but I'm lucky. I have colleagues that are struggling. They don't have symptoms, but they working full time. They live in 1 or 2 bedroom apartments with a partner that's working full time. You know, they have small children, babies or toddlers. They don't have daycare. You know, I'm in bed all day. My husband's doing everything. I mean, honestly, I probably shouldn't complain. My husband's being wonderful. I feel really bad for him. If anything, I want to get healthy to help him out. The cooking is getting very good.
Okay, so well, unless you have anything else to add, I think we could end it there. We could speak all day, I think, and maybe we'll do this again. Who knows? If the situation, you know, in a couple of weeks, maybe we could try to have another talk and see where things are at and how things have changed and evolved on everyone's side. Maybe Amanda will be in top shape, and Antoine is going to be up to his. It's going to be a war zone, or it's going to be sick. Yeah. So, but thank you very much, Amanda and Antoine, and get well, take care, enjoy the good cooking. Yeah, and thank you very much for partaking in.
Both. Thank you both. Bye.
Thank you for listening to this podcast. For more podcasts and videos by the Center of Excellence on Partnerships with Patients and the Public, please subscribe to our channel. We will try to bring you as much informational and educational content as we can throughout the COVID-19 crisis. Thank you, and please stay safe.